how can we diagnose pulmonary tuberculosis or lung tuberculosis? This again is very important. So the best way to diagnose TB is to identify the bacteria which causes TB. So where do we look for this bacteria is main in the sputum. So for people who can cough and bring out sputum, we examine the sputum for the presence of this TB bacteria, TB bacilli. In people who cannot produce sputum, then sometimes we do what is called as bronchoscopy. You put a small camera in the lungs, collect the sputum and send it for testing. So this is the most important, most definitive way to diagnose tuberculosis. So in the sputum, what do we test? So there are again several tests which are there, which I think is important for public also to know. The three tests which are done are, one is looking under the microscope. So you put the smear under the microscope and directly look whether you can see the bacteria or not. That is called as smear examination. So that if that is positive, then it is tuberculosis. But the problem with this is that it is not very sensitive. So if the disease is not very high, then you might miss on the microscopy. Then you have genetic tests. So you can look at the TB gene by what we call as expert MTB. This is now validated by Government of India and by WHO also. So sputum can be tested for what we call as expert MTB. That is the test which is recommended. This is very sensitive. Even when the microscopy is negative, expert can be positive, and we can get the result of this expert in only 2 to 3 hours. So that's a very fast test also. So nowadays we recommend expert MTB as one of the main tests for diagnosing tuberculosis. Third way on the sputum is the culture. So you grow the bacteria. So you put it in a medium and the bacteria grows and then you see. That is called as culture. But culture is also very good, but it takes a lot of time. It takes 2 weeks to 6 weeks. So these are the three techniques by which you can look at the bacteria and confirm tuberculosis. But again, it is important that not everybody will have this positiveness on the sputum or bronchoscopy. The other way to diagnose TB is to look at the X-ray or the CT scan. Sometimes on X-ray and CT also you can suspect tuberculosis and you can start persons on ATT if the picture is very characteristic. So this is how a TB will be diagnosed. Many people ask, can we diagnose TB based on a blood test? The answer is no. So as of now, you do not have any blood test which can confirm the diagnosis of active pulmonary tuberculosis. I think this is about, very simply about how we tend to diagnose tuberculosis. One is sputum, second is the bronchoscopy if required, X-ray, CT scan, and the best way is to look at the bacteria and then confirm the diagnosis.